Enasidenib, also known as Idhifa, is a medication used to treat a specific type of blood cell cancer called acute myeloid leukemia, AML. It works by assisting the bone marrow in producing normal blood cells, which can reduce the need for blood transfusions. It is important to follow the prescribed daily dosage and take Idhifa at the optimal timing recommended by your healthcare provider. Before starting Idhifa, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth once daily, with or without food, as directed by your doctor. Remember to swallow the tablets whole, and do not crush or split them. It's important to take Idhifa with a full glass of water, unless your doctor tells you otherwise. The dosage of Idhifa is based on your medical condition and how you respond to the treatment. To get the most benefit from this medication, be sure to take it regularly at the same time each day. Do not increase your dose or use Idhifa more often or for a longer period of time than prescribed by your doctor, as this can increase the risk of serious side effects. If you happen to vomit after taking a dose, take another dose as soon as possible on the same day, and then take your next dose at the regular time the next day. Do not double the dose to catch up. Following these instructions will help you maximize the benefits of Idhifa treatment. Some common side effects of Idhifa may include diarrhea, nausea, vomiting, change in taste, or loss of appetite. Your doctor may prescribe medication to help with these side effects, and eating several small meals or limiting activity may also help lessen them. It's important to tell your doctor if any of these side effects last or get worse. It's important to remember that your doctor has prescribed this medication because they believe the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Enasidenib may cause side effects due to the rapid destruction of cancer cells, such as tumor lysis syndrome. To lower your risk, your doctor may add a medication and tell you to drink plenty of fluids. It's important to tell your doctor right away if you experience symptoms like low back/side pain, muscle spasms, or weakness. It's also important to seek medical help immediately if you experience very serious side effects, such as signs of kidney problems or yellowing of the eyes and skin. While it's rare, a very serious allergic reaction to Idhifa may occur, and it's important to seek medical help if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. However, if you do experience any side effects, it's important to call your doctor for medical advice. Idhifa, also known as Enasidenib, is a medication that is used to treat a certain type of blood cancer called acute myeloid leukemia, AML. It works by slowing down the growth of cancer cells. It is important to be aware that Idhifa may rarely cause a serious condition called differentiation syndrome, which can be potentially fatal. This condition can occur at any time during the first 5 months of treatment. If you experience any signs of differentiation syndrome such as fever, cough, difficulty breathing, bone pain, rapid weight gain, swelling of the arms or legs, swollen lymph nodes, dizziness, fast heartbeat, or chest pain, it is crucial to seek immediate medical help. The daily dosage and timing of Idhifa will be determined by your healthcare provider based on your medical condition and response to treatment. It is important to follow their instructions carefully and take the medication at the same time each day as directed. Before taking Idhifa, it's important to talk to your doctor about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your doctor before using this medication. If you are planning to have surgery, make sure to inform your doctor about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor before starting Idhifa. This medication may harm an unborn baby, so a pregnancy test may be ordered before starting treatment. Both men and women using this medication should inquire about reliable forms of birth control during treatment and for 2 months after the last dose. If you or your partner becomes pregnant while using Idhifa, it's important to talk to your doctor right away about the risks and benefits of this medication. It is not known if Idhifa passes into breast milk, so it is recommended to consult your doctor before breastfeeding while taking this medication and for 2 months after stopping treatment. When taking Idhifa, it is important to be aware of potential drug interactions that could impact how the medication works or increase the risk of serious side effects. Keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and make sure to share this list with your doctor and pharmacist. It is crucial to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Idhifa. If someone has taken too much Idhifa and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call 1-800-222-1222 to reach your local poison control center. In Canada, residents can call their provincial poison control center for assistance. It's important not to share Idhifa with others, as it is prescribed specifically for individual patients. Before starting and during the course of taking Idhifa, it's necessary to undergo lab tests, such as complete blood counts. It's crucial to keep all medical and lab appointments to ensure the medication is working effectively for you. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take 2 doses to make up for the missed one. When it comes to storing Idhifa, it's important to keep it in the original container at room temperature, away from light and moisture. Avoid storing it in the bathroom, and make sure to keep it out of reach of children and pets. It's also crucial not to flush Idhifa down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, be sure to properly discard it. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.